Okay, we're recording. Josh, we're not live. We're recording.
It's live to me.
Another edition of Between Two Molars. I'm one of the Molars, Trevor Maurer. The other Molar, Dr. Josh Everts.
Good to see you, Trevor. We've got a great guest on today.
Special
Sarah
guest.
Davies. Yeah.
Yes, hello.
Hello.
Great.
Long-time listener, first-time caller, I hear.
Yes.
Well, welcome to the show.
Thank you.
I think we'll start with, in the pre-show dialogue, you've deferred your dad joke to Dr. Everts.
I have.
Okay.
All right. I got a good one. What's ET short for?
Extraterrestrial.
He's got little legs.
Right? Oh. Jeez. Where'd you find that?
I was gifted a whole bunch of dad jokes by our staff a long time ago. I've got dad jokes for days. We got a lot of podcast episodes. Yeah, they're hilarious. We pass these around at our holidays. So,
wow.
Nice.
Some of my favorites.
Dr. Davies, let me ask you a question. What would you like to share with the broader group here? Something interesting about yourself that we might not know.
Well, I mean, some of you probably all do know, but I'm like love to cook and eat. So I think I like learned to love to cook from cooking with my grandma when I was a little kid. She's Italian, and we would go there for like a week, and my sisters would want to go home, and I'd want to stay another week, so I'd stay another week with my grandma, and we'd cook. But then I like waited tables in college and dental school at like a nice restaurant, and that got me more interested in like kind of the broader sense of cooking and wine. And so I love to cook. I'm mostly like eat a vegetable based diet. I eat some fish, but so my husband, we have a small yard because we live in the city, but we have a really good urban garden. So he's the farmer and I cook it. I mean, we have a short growing season in Pittsburgh, but you know, he grows a lot of stuff even in the basement. So that's, I guess, I cook most nights of the week. Maybe we go out once a week, but every other night I cook. Work all day.
At a retreat. Is Josh really focused, or is he frozen?
I think he's frozen.
I'm back. I'm still there.
How's that?
See me?
A little frozen,
I'm
but
still.
kind of foggy.
Oh man, I'm here. That's great. I love cooking. Big fan of Emeril Lagasse. You follow any of his recipes?
Yeah.
That's great. What? Well, tell me a little bit about what you love about oral surgery.
So, I mean, I think what I like most about it is kind of the combination of being able to like do surgery, which is kind of fun, working with your hands, and like technical aspects of it, and trying to be like precise and perfectionist, and also just interacting with people all day long. Hopefully making something that most people hate. I mean, I know we all hear it every day. I hate the dentist. I hate coming here. I mean, literally almost every patient comes in, and if you can make someone have a good experience out of that, I think it's rewarding. So that's what I like about it.
Yeah, that's fantastic. Are you are you someone who's come from a line of hospital care, or do you have relatives or family
my
that's in
father's a general dentist, so I think that's sort of plugged me into dental school. I actually thought that's what I would do. I didn't really know a lot about surgery, medicine.
Did you work in the practice growing up?
What's that?
Did you work in the practice growing up?
Not like that much. I mean, I worked sometimes helping like clean up in the back instruments and stuff. I didn't really do a lot of hands-on, but I kind of watched a little bit. But I actually remember him saying to me, "You're sure you don't want to go to medical school?" And I was like, No, I just want to go to dental school. But when I got to dental school, I mean, I really, really loved anatomy. Like, loved it. I mean, I was like a TA for like the other classes, you know, and my like one of my good friends in the class like was going to oral surgery, and he's like, "You need to come with me on the rounds with the residents." And I don't know, it just got me. I thought it was really cool. So I also just was like, I don't know. I think I thought that's what I should do because you know, when you're a high achiever, you're like, "No, this is what I'm supposed to do." So, and then
one more thing.
Yeah, I mean, you sometimes don't even know what you're getting into, but you know, like they're like, "Oh, if you're top of the class, you should be a surgeon." So I'm like, "Okay, that's what I'll do." But I do like it.
Yeah, good thing you like it too. That worked out well for you. You guys are relatively new at partnership. I'd love to hear just maybe a little bit about your experience. some things you've enjoyed, maybe things you've enjoyed that you didn't realize you might enjoy, and how things have been going.
Yeah, I think the most surprising thing for me was sort of the interaction with the larger group of surgeons. I don't think I realized that it would be so much camaraderie amongst the other surgeons and willing to help, and that's kind of even being from a group of 5, where we could like ask each other things. You're still sort of like tunnel visioned into your own practice, and be able to see how other people do things, collaborate on that. Like, how can we do better? How do you do it? What do you do in this instance? Not just with the surgery aspect, with the whole running the practice has been really informative and interesting. So
something 2 of your partners said to me that really surprised me, and I'm glad it happened. They said, after you started talking about partnership with us, and then once you formed the partnership with us, it actually brought your group of 5 closer because you were doing a lot more discussing as a group.
Absolutely.
How you wanted this to look. Is that right?
Yeah, absolutely.
That's great. Yeah. That's a nice side product for sure.
Yeah. And then like the along with the other doctors, like the CE that you're organizing, and like best practices, things, all that stuff, I think is great.
Well, I want to indoctrinate you, is that the right word? As an honorary Canadian. As you know, I'm from Saskatchewan. I'm representing. Yes. So I'm going to time date this episode. We just got the World Series last night, but I want to recognize you for your usage of the Canadian toque. This is a toque. Y'all will call it a beanie or whatever in the US. Yeah. But you have the most well-traveled OMS 360 white toque I've ever seen.
Yeah, it goes everywhere with me.
What countries has it been to?
It went to Portugal, Croatia, Slovenia, and Italy so far.
I think
we got a couple more this year, hopefully.
Awesome. That's great. Well, thanks for traveling our toque around the world. Yeah. As soon as we expand to Europe, you'll be the first ambassador.
Awesome.
Anything else, Dr. Everts?
Great podcast. Thanks, Sarah.
You're welcome.
Thanks for being on.
Thanks for having me.
You bet. Go Blue Jays.
See you guys.